From the State House, Vermont's EMS workforce had already been facing challenges prior to the pandemic, and 2 years of added stress has only worsened money and staffing woes. Today, EMS leaders met with Vermont lawmakers to go over those concerns as a different kind of rescue effort takes shape in the capital city. Devin?
Yeah, Lauren, in 2020, nearly 1/3 of the workforce in ambulance services left after just 1 year, and 11% left after 3 months. Trying to keep up with recruiting, retention, and responding to calls is only half the battle.
COVID has been terrible on the EMS workforce. It's increased our costs significantly. It's not a good picture, and I just want to make sure we appreciate the help, but it's going to take a large effort.
Jim Finger is the president of the Vermont Ambulance Association. On Tuesday, he helped Vermont lawmakers get a better sense of what's causing the financial burden felt by EMS departments across the state. The cost of equipment, fuel, and training plays into that, but some say a lack of volunteers has had the largest ripple effect.
That's again putting a strain on the whole workforce because there used to be a lot of volunteers that volunteered their time and had other jobs. And now you have the workforce where a lot of volunteer agencies are ending up having some partial or paid personnel.
For EMS departments, efficiency is always important. With fewer workers, it's a necessity. Will Moran, EMS chief for the Vermont Department of Health, said that's been hard to maintain.
One of the things that we saw during COVID was that we had an EMS system that was under a tremendous level of stress. And not every organization was able to operate at the level of efficiency or capacity that they otherwise would have been able to pre-pandemic.
Earlier this legislative session, a proposal came forward to transition Vermont to regional emergency communications centers. EMS agencies have voiced concern that they'd be absorbing the cost, but Moran is more open to the concept.
I do agree with Commissioner Sherling in that regional dispatch should be the future of dispatch across our state. I do think there is an opportunity for us. We know that there is significant funding on the table.
And I should mention he was referring to Department of Public Safety Commissioner Michael Sherling there, who presented that proposal. And the funding he alluded to in those comments comes from a bill Senator Bernie Sanders is getting ready to introduce as early as next week. That would open up $500 million in grant funding to help EMS agencies hire, recruit, train, and buy new equipment. Live in the newsroom, Devin Bates, Local 44 News.
Devin.